Just for the audience at home, we're going to show from a different plane because Rio's squat is actually very good. Rio's going to put his hands up again. He's going to look straight ahead with his chin in. He's going to squat nice and slow, as deep as he can. Good. So the ears, the shoulders, and the hips are pretty much in line. The depth could be a little bit better, but he just might be a little tight in the hips. But the ease at which he got into the squat, the depth, and his balance in the squat is very good. Come on up. We're here with Lou, 37-year-old. He's a recreational fighter, and we're going to do a self-assessment on Lou. Basically, Lou would be facing a mirror as is. First thing we're going to have you do is to kind of destabilize the nervous system a little bit, and we're going to have you march in place, please. Knees a bit higher. So you do this at home for a couple of seconds, and what this does is just, when I have you stand statically, it's going to be more natural. So look straight ahead and stand normal, relaxed, okay? First thing we're looking at, or Lou's looking at home, is going to look at his feet and his ankle. And look down, Lou, feet, ankle, and you're looking at the relationship of one to the other. Or basically, does one look like it's turned out, one look like it's turned in? Do you look like you're rolling in on one, rolling out on the other? They look pretty balanced, they look pretty straight for the most part, slightly out on the left on him. Second thing you're looking at is the position of the hands with relation to one another. Lou's right arm or right hand is lower than his left. Look down, Lou, see if you confirm that. Okay, so there's lateral flexion. Whether it's coming from the pelvis or coming from the torso, we don't really know yet. The third position he's going to look at is his belly button with relation to the pelvis. It looks pretty even, actually. It doesn't look like it's off one way or the other. Lou would be looking in the mirror and looking directly at the belly button and the pelvis, right at the hip joint, which is right here, right at that bony structure there. It looks pretty good. The fourth thing Lou would look at is the position of one nipple with relation to the other. And it looks like the right is lower than the left by a little bit. And that matches the fact that the right arm is a slight bit lower. The fourth thing he's going to look at is the relation of one clavicle, this bone right here, with relation to the other. And the right is slightly lower than the left as well. The next thing Lou's going to look at is his relationship of the shoulders and their height with relation to each other and with the position of his neck. So again, everything matches. The right shoulder is a little bit slightly lower than the left. And finally, he's going to look at in the mirror the position of his neck with relation to his shoulders, which looks pretty straight to me standing. There might be a little lateral flexion to his right. So that's the first static exam. Okay, so the second part of the standing static self-examination, we're going to have Lou turn 90 degrees to his left. Lou? Perfect. Okay, and what Lou is going to be looking for over his right shoulder, Lou, look over your right shoulder. He's going to be looking in the mirror over his right shoulder, and he's going to look for the signals that I'm now going to point out in terms of your standing static posture. Look straight ahead, Lou, now. Okay, what he's looking for is a nice alignment between the ear, the middle of the shoulder, the hip, and the middle of this bone in the foot here called malleolus. Okay? In Lou's case, what we see is that the head is forward of the shoulders and the hips. The shoulders are not too bad in alignment with the hips, and the foot, the malleolus, is slightly back. So the hips are slightly forward, the shoulders are slightly forward, the head is definitely forward. So we would look for a nice straight line in terms of what, let's show what that should look like. Lou, tuck your chin for me. Shoulders back. Contract your lower abs. Hands by your sides. So that's a much better alignment, as you can see. Okay? Lou, stand naturally. Just relax. Once again, you see, he falls into that 74% of the population that's slightly forward neck posture, slightly kyphotic, which means his shoulders are rolled forward, and he's making the adjustment at his pelvis so that he can stay upright, basically. Okay? Part 2 of the static exam is going to be seated. Lou, have a seat. He would face the mirror with his palms up. Okay? look straight to the camera. What Lou is looking for now, since the pelvis is not a factor, he's looking at the level of the chest with relation to the two nipples. You can still see that the right is slightly lower than the left, okay? So that part of that flexion that we noticed when he was standing is coming from somewhere in his upper body or his torso. The right shoulder is slightly lower than the left, so you're looking at first the nipple height, then you're looking at the shoulder height, then you're looking at the position of the head. This position of the head is slightly flexed towards the right, or what we call laterally flexed to the right. That's an exaggeration of it, but that's what I see. So if he's looking in the mirror, he's going to see a bit more space here than here. You want to see an even space here to here. Okay? All this information, you put it in your pocket, and you just assess yourself on what your posture is with relation to normal versus certain compensatory positions. Okay? The first dynamic test is standing. Stand, Lou, face the camera. Perfect. Feet a tiny bit wider. You're going to be standing next to a wall when you do this exam. So today I'm the wall, and Lou knows that I'm close enough where if he loses his balance, he can put his hand on me or the wall. Okay? Now what you're going to do, Lou, is you're going to raise all your toes on your feet, please. Perfect. And you're going to close your eyes. You're going to keep your eyes closed, and then after a few seconds, you're going to put your toes down, please, and then open your eyes. What Lou's looking for, or you at home are looking for, what was the sensation? Did you feel like you were neutral? Did you feel like you went slightly forward, or did you feel like you went slightly backwards? What did you feel, Lou?
Neutral.
Okay, so you felt pretty neutral, which means that in terms of him managing his center of gravity without the use of his eyes as an information center, he's pretty good. He feels like he manages it pretty well. Most of the population will feel like they fall slightly forward if you show static postural indicators like Lou. So that 74% will feel like you have a little sensation like you're going forward. Okay? In Lou's case, he's very good at managing that, even though he shows this posture. All right, so the second test we've done is the squat. And Lou, I want you to squat facing forward, hands out extended. You're going to face the mirror, and when you look in the mirror in your squat, you're going to look at a few indicators. Squat down, Lou. Okay? And up. Good. You're going to look at with the ease at which you can get into the squat. Okay? Secondly, you're going to look at, do you feel like you shifted right or left? Do you feel like your torso was straight, or do you feel like you needed to go forward? Okay? Lou, face that way so we can show the audience what we see with your squat. Okay? Hands out in the front, please. Okay? Squat and stay at the bottom, please. Okay, good. So Lou's depth is compromised. It was a little bit difficult for him to get down there. And he leads with his hips. His hips are so far back from his shoulders in order to keep himself straight. So come on up. So dynamically, it matches what we saw statically in terms of he has to make an adjustment when he squats. These are the tools you're going to use, and after you do the corrective exercises, the myofascial stretches, you're going to retest and see, okay, can I get into the squat a lot easier now? Is it smooth? Is my torso straighter? Those are the indicators of whether or not you improved. Hey everyone, we have Jess here, 23-year-old former gymnast and diver. And again, the purpose of the initial evaluation is for the audience to be able to get the tools to evaluate themselves with using 4 very, very simple tests. The first test we're going to have you do is the first static standing test, but we're going to basically get a good reading by having just march in place. So just march in place for me. Good. Okay, so you at home, you march in place for a few seconds just to kind of give a fair reading of what we're doing. Separate your feet a little bit, Jess, and then stop marching. Perfect, okay? Now, she's going to look at a couple of points on her body and basically utilize the information to make a self-assessment. First is foot ankle. So look down at your foot and ankle. You're looking for an imbalance from right to left. Are they both straight? Are they both out? So what she pointed to correctly was that the left one is externally rotated or slightly out. Okay? That's one piece of information we put in our pocket. Next, Jess is going to lift up her shirt a little bit, about belly button height, a little bit higher. Looking in the mirror, she's going to look at the difference between, actually let your arms relax. She's going to look at both, please. She's going to look at the difference between the belly button height and the height of her hips as measured by the front of her hip bone there. Okay? She's looking at symmetry. Is my right hip higher than my left? Is my left hip lower than my right? Looking at, thirdly, she's going to look at the difference between the level of her fingertips and her hands. Is my right lower than my left? Is my left lower than my right? Get that information. Looking at Jess now, I see that the right is slightly lower than the left. So she's slightly laterally flexed. The left pelvis is slightly higher and the right is slightly lower as well. The next point she's going to look at is her clavicle here. Okay, so you at home, if you can wear a sports bra or something where you can see the clavicle, you're looking at the difference between the height of the clavicle and symmetry. Next point she's looking at is her shoulder height with relation to both her neck in the mirror and with relation to each other. So I can see again it matches pretty much what we saw before. The right shoulder is slightly lower. It's very, very subtle, but it's there. So we take all that information and we put it in our pocket. Next we ask Jess to turn 90 degrees to her left. Okay? Now at home she's going to look over her right shoulder into the mirror, but right now I'm going to point out what I see and what you'll be seeing at home in the camera. We're looking for a nice straight line between the ear, the middle of the shoulder, the hip, and the middle of the foot ankle here at this bone called the malleole. In her case, the ear, the hip, and the ankle line up pretty good. Not too bad actually, but the shoulders are slightly forward. We can see that on camera. So if I'm looking for a correction, I would say that's better. Chin in a little bit. And squeeze your abs. And that nice straight line is what we're looking for. Okay? In her case, she manages her center of gravity just slightly forward, which again falls into that 74–75% of the population. Being a gymnast and being a diver, a lot of what she did was internal, so it makes sense. Okay, so that's your first static test. Second one is seated. Please have a seat. She'd be at home facing the mirror, or now facing the audience, palms up on the lap. Good. Now we eliminate the pelvis, so we're looking at the clavicle again, and we're looking at the shoulders. Well, the shoulders look pretty level now with relation to each other, and so does the clavicle, which to me means that the pelvis is a bigger factor in why she was laterally flexed or why she was a little bit lower standing. Okay? She's also going to look in the mirror at her neck or her head in relation to her shoulders, and you see that there's a slight bit lateral flexion to the right. So it's just a tiny bit of flexion this way. I'm going to exaggerate it, but she manages the center of balance just slightly to the right a little bit. So we take all that information at home and we put that in our pocket and we write it down with the goal of within 2 or 3 weeks after you've been doing the exercises that you retest. It'll take you 5 minutes and it's pretty easy to look in the mirror and do these 2 static tests. Next test we're going to do is more dynamic. Standing, Jess, please. Feet about shoulder width apart. Take a step forward. Okay, good. Now I want you to raise all the toes on your feet, please. Good. Once you get your balance, I want you to close your eyes. Okay? Now we eliminate the ocular input from the eyes. I want you to keep your eyes closed. I want you to put your toes down, please. And open your eyes. What she's looking for, what you're looking for, what was the initial sensation? Was it, did I feel like I went forward? Did I feel like I didn't feel anything at all? Or did I feel like I went backwards? What did you feel?
Nothing at all.
Okay, so neurologically she manages her center of gravity pretty good considering that there's a slight anterior scapular plane. Okay?